The Joe Rogan Experience, a podcast hosted by actor and comedian review. Okay. Claim 1. The emergency use authorization is a new mechanism or previously unused mechanism for regulatory pathways of drugs. The emergency use authorization mechanism isn't new, nor was it unused prior to the COVID-19 pandemic. EUAs have been issued by the U.S. Food and Drug Administration for tests and medicines long before the pandemic, such as for Ebola and the Zika virus, as this FDA page demonstrates. Claim 2. There was an intentional, very comprehensive suppression of early treatment in order to promote fear, suffering, isolation, hospitalization, and death. And it seemed to be completely organized and intentional in order to create acceptance for and then promote mass vaccination. These are the guys. For the record, this is one of the 2 doctors that Joe Rogan is defending in the beginning of this, where he said, like, oh, I had like 2 doctors on.
Fact. Like, for instance, creation of MR.
This guy.
Dr. Peter McCullough, and one with Dr. Robert Malone. Dr. Peter McCullough is a cardiologist, and he is the most published physician in his field in history.
That's who he's talking about. That's who he's saying. The guy who said these things on his podcast, that's the way that he talked about it. That's the way he brought that up. It's pretty clear that this pandemic was planned. Throughout the podcast, McCullough claimed that the pandemic was planned or that public health authorities and or scientists conspired for an unnamed reason to keep people from getting treatment. But he never provided any evidence to support these claims. These claims also made regular appearances in Plandemic, a 2-part pseudo-documentary that went viral in 2020 and propagated baseless conspiracy theories about COVID-19. He said, if you want to see the Johns Hopkins planning seminar called SPARS, Pandemic in 2017, where they had a symposium, people showed up, they wrote up their symposium findings. They published this, and we're going to utilize all that in order to railroad the population into mass vaccination. It's laid out in the Johns Hopkins SPARS Pandemic Training Seminar. It was a teaching and training resource published by the Johns Hopkins University for Health Security. The document was developed as a self-guided exercise scenario. At no point is it stated that the aim of the document is to railroad the population into mass vaccination. Now they're saying, no, you have to have a 3rd dose. And now they're considering a 4th, which is wild, and there's no end in sight. McCullough implied that having to take multiple doses of the COVID-19 vaccine is unusual or unprecedented. This isn't the case, however, as certain childhood vaccines that have been used for decades, like diphtheria and the polio vaccine, require 4 or more doses of complete immunization. Masks only filter out 3 microns. The virus is 1 micron. The claim shows that a lack of understanding about how virus transmission works. While it is true that a virus particle is smaller than a micron, and thus smaller than the pore size of a mask, the virus particles cannot travel in the air on their own. Instead, they need to be carried by liquid droplets. And these are larger than the pore size of the mask. By blocking the liquid droplets, masks also block the spread of the virus contained within. But one of the original antigenic vaccines that was tested in Australia exposed the HIV epitope, and it turned everybody in the trial HIV positive who took a COVID-19 vaccine in Australia. These young people were outraged, and so this was on the internet. It was quickly suppressed. This is a reference to a COVID-19 vaccine that was being developed by scientists in Australia. Its development ultimately halted because certain people who received the vaccine in a safety trial had false positive results from an HIV diagnostics test. This was because the vaccine candidate had used a small portion of a protein from HIV to improve the stability of the SARS-CoV-2 spike protein. It is important to understand that these people weren't infected with HIV by the vaccine. Instead, they developed antibodies against a particular HIV protein. And these antibodies happen to be the target for certain HIV diagnostics tests. Which, by the way, for the record, this actually is really good. You want to know why? Because this is also now being tried as an HIV vaccine. Did you guys know that? I brought it up in the beginning of the show that the Moderna mRNA vaccine has now started its clinical trials in the United States of America against HIV. This doesn't mean that the COVID vaccine that you got is going to give you immunity to HIV. It means that the mRNA technology can finally put an end to people getting AIDS. By the way, that's precisely why they wouldn't let the third world countries have the IP, as I mentioned earlier in the show. Yes. No, it's not fake information. No, this is reliable information. I talked about this when I talked about Bill Gates not wanting any of the vaccine IP to be released. That like the mRNA technology is actually really, really valuable because it's new and it can potentially be used against AIDS and even certain kinds of cancer. Yeah. McCullough's imprecise use of the term HIV positive described the vaccine trial participants could give viewers an inaccurate understanding of events. So the big discoveries in 2020, the virus is not spread asymptomatically. It only spreads from sick person to susceptible person. This is important. Two major papers, one by Cal from China, one by Madewell nailed this down. That's also not true. It's not asymptomatic. It's pre-symptomatic, a distinction that does not matter to anyone. It's just a scientific distinction. You remember this was like 2020 memes, by the way. This is literally 2020 memes that he's doing on the Joe Rogan Experience. I already mentioned the HIV trial. Yeah, first patients vaccinated in clinical trial of HIV experimental vaccine that uses Moderna's mRNA technology. This is happening right now. McCullough's claim, I'm not even going to go into that. That's so fucking disproven that it doesn't matter. And now CDC admits finally through a Free Information Act led by attorney Aaron Siri, pressed the CDC and said, listen, you're saying you can get COVID twice. Show us a case. Show us a case. Press. Finally, the CDC director came out and said, you know what? You can't get it twice. We've never had a single case. Wait, what? I don't even remember this one. How can you say you can't get reinfected twice? Jair Bolsonaro! Bolsonaro! At this stage, motherfuckers, you know someone that's gotten COVID twice. I know people that got COVID twice. Joe acknowledged that McCullough was lying here on this one. How does this not make you go, maybe the guy I have is a charlatan, but instead he's defending him here. Most published fucking cardiologist or whatever the fuck. That's crazy. It's just wild. To make matters worse, you see that it now admitted the methodology they used for the PCR, the original CDC methodology that was distributed to all the departments of community health and where the laboratory-derived assays for the health systems in the early parts of the pandemic cannot distinguish between flu and COVID-19. That's not true either. The lab alert was exploited by certain outlets that misconstrued it as an admission that the PCR test doesn't work or that it cannot distinguish between COVID-19 and the flu. However, the lab alert itself explained that the EUA withdrawal wasn't due to problems with the performance of the PCR test for detecting COVID-19, but because the tests that are capable of processing more samples within a given time and detecting more than one pathogen have since been developed. Once somebody takes a vaccine, the hospitals don't test them for COVID. This is not true. It's really just everything that this motherfucker said, everything that this dude said about COVID, pretty much, as the main guy that he had on for COVID, was just a lie.
Love you, Has.
Malone came on after and tried to correct and defend him, saying it was pre-Omicron Delta, which is bullshit too.
$18 months and 0 bans. Let's go.
I live in Iceland. I've never gotten COVID, but most people here are getting it from the Omicron wave. Most of us are vaccinated, though. My grandma died from COVID because she broke her hip. This is what happens when a bunch of people never trained or involved in the scientific process take part in the scientific process. So I don't see why Jerry wouldn't have you contact. I wouldn't have you if you contact someone who's in touch with them. I think Joe doesn't know your current stance on him. His sidekicks might though, but I bet they're also sick of his COVID rhetoric. No, I don't think so. I think most people see Joe as like a brilliant fucking truth teller, dude. That's the problem. At this point, I'm certain they won't acknowledge the reality until they're on their deathbed. My stepdad has had COVID for 3 weeks and is dying in his room. He finally admitted yesterday that the virus is dangerous and he should have gotten vaccinated. I, 22-year-old and double vaxxed, was sick for 2 days and have been fine since, despite catching the virus a couple days after him. I'm sorry, man. I hope your stepdad is all right. But it's just far too late at that point. I mean, I have chatters in here. Just Lane just talked about it earlier. Her father passed away from COVID. He used to watch fucking Joe Rogan and numerous other things like Fox News and shit. This stuff has real consequences on people, okay? That's why I don't, that's why whenever I fucking yell at people and say like, oh, fuck you, if you die of COVID, then don't get the vaccine and then die of COVID, I'm going to laugh at you like, this is the other very real side of it. Like, I know people whose parents who are anti-vaxxers and have COVID now, okay? Like, that shit sucks.
Transgender pride scared for my Republican parents. I wish I could convince them it's dangerous and need to get vaccinated.
You know? CDC and FDA didn't have any safety review. This is a ridiculously inaccurate claim. Simply reading the first page of the FDA decision memorandums for COVID-19 vaccines that are currently in use clearly shows the clinical trial data was reviewed for safety by medical doctors and scientists. We're at 18,000 deaths, and this is just VAERS, which is underreported. This is an example of how the vaccine adverse event reporting system is commonly misused. This is one of the main tools of the COVID deniers. One of the main tools that COVID deniers use, which is fucking preposterous, ridiculous, awful, you know, bullshit.
He'll be laughing at his death.
Okay, frustrating. VAERS is not designed to determine if a vaccine is caused a health problem, but especially useful for detecting unusual or unexpected patterns of adverse event reporting that might indicate a possible safety problem with the vaccine. Okay? That's what VAERS is there for.
Hassle.
Scientists rely on many other indicators aside from temporality to infer causal events, which is extensively covered in an Insight article by Health Feedback. VAERS is not a reputable source of information. Whenever there's a new vaccine out, people constantly fucking go to VAERS and look at VAERS and say, oh God, this vaccine is killing people. Okay? And I think that about wraps it up for this fucking Joe Rogan take. I mean, that's it.